Dina, this has been very, very long awaited. We're finally talking about supplements for masters athletes. And, masters athletes, as we've talked about in the past, I don't know what episode that was, but listen, a masters athlete can actually be qualified as maybe you're in your 30s, depending on what sport and what organization you go through. In other organizations, other sports, it's not until like you're 50 and you're a master's athlete. So we're not really going to pick on the chronological age as much as we're just going to talk about the aging athlete and throw in a little bit of longevity here because I don't know about you, Dina, but longevity, everything is popping up everywhere. I mean,
Hmm.
from documents, I mean, supplements, obviously we're talking today, to research, to, you know, I guess industry professionals, right? Every like
Yeah,
you can't pick up anything without hearing about longevity, right? Everyone's got their little tune to it. Did you see, by the way, the documentary on Netflix about Brian Johnson?
I have not yet.
Oh, it's
Mm-mm.
interesting. And listeners, if you haven't seen that, if you haven't watched that yet, I would highly recommend it. It's well, I'm just gonna save, I'm not gonna tell you any of my thoughts regarding it. I would just say, just watch it. Okay.
Okay,
All right.
okay.
So that said, all we're going to do today, listeners, is we're going to provide a little bit of background on some of these supplements that are starting to come up more and more for masters athletes, for aging athletes. And again, it could be for longevity purposes, it could be for sport purposes, but these are by no means is this an exhaustive list. These are just some of the more popular ones that either we're dealing with or that are kind of on our radar that we've been maybe having some low level discussions with. So, what we're not going to do in this episode is teach you about every single supplement that we're talking about. What we're going to say is we're going to just give you our feedback regarding maybe it could be useful, maybe not so much. So, we're just going to kind of we're going to bounce back and forth between Dina and I and just give you our honest feedback regarding these supplements pertaining to masters athletes specifically. Does that sound good, D?
Yes.
Okay. Should we put our
I'm
little qualifier out there first? Like, of course,
yes,
as we've said
yes.
before, like, remember safety with supplements, third-party organization, certification, high quality control. Okay, I kind of feel like we always need to kind of remind people about that. Like, just don't pull a supplement off the grocery store shelf.
I know. I feel I would be remiss to not mention like the power of having a full dietary assessment with your dietitian because more is not better with supplementation, and we can do a lot with the power of food, right? I would refer to some of the conversations we've had on the genomic context
Hmm.
as well, that sometimes supplements can actually work counter to what we're looking for. So,
Yeah.
quick
And I will
disclaimers
also
there.
say, I will probably say this a million times in this short episode, but some of these supplements, we can't measure their their ability to be beneficial or not. Like you just
Mhm.
like there is not a test to measure some of these. So, it's kind of funny when I have some masters athletes taking these, I'm like, okay, fine, but as long as it's not doing any harm, I guess, but how do we measure? How do we know they're actually working? Well, some of them you can't. Like let's take on the opposite side, like vitamin D. Take vitamin D, go get a vitamin D test. Okay, there you have it, right? You can see if it's working or not in terms of increasing your levels. But some of these are they're a little sketchy.
Yeah.
I'm not gonna, kind of cut corners here.
Yeah, sketch. And we don't have that much robust research behind some of these, despite
Right.
what some of the influencers are telling you that it's going to change your life and have
Yes,
you live till
yes.
you're 120. I would be like, put the seatbelt on and put the brakes on because that's
Yeah.
just a little bit. Although I know you and I have sometimes a reputation for being a little more cutting edge. Like, well, we can't wait 10 more years for another research study to come out, and doing our best to balance, or maybe that's not the best word, but like, okay, there appears to be no harm and this appears to be safe with everything we can see, and so let's try it for a period of time. But
Yeah.
anyways, I digress.
So as we go through this listy, here's what I'd like to do and give our listeners. I'd like each of us to give a green light, yellow light, or red light at the end of each one that we discuss. And that just means, would we recommend it? Are we kind of on the fence? Maybe, maybe not, or definitely not recommend it. And of course, there's no context to this at all. So it's kind of unfair to put us under that. But, let's just give our listeners kind of our feelings about these things. Yeah, I have a feeling it's going to be green light. but
Yeah, some of
under
these,
these conditions.
yeah, yeah.
Yeah, yeah.
Okay.
Okay, so I like to separate these into basically two categories. More of a foundation category, which is okay, there's some pretty good research in some of these. So let's talk about foundation supplements for masters athletes. And then there's what I call next level. And that next level is kind of a it's not sketch, but it's definitely maybe we don't have a lot of research yet, but you're seeing these supplements pop up everywhere. Okay, so
Mhm.
let's begin with a very common one, very, very near and dear to our heart, vitamin D, the sunshine vitamin, which is actually a pro-hormone, which we've talked about in the past. But
Yeah.
vitamin D, and sometimes with vitamin K, with that, it kind of depends on the person with the master's athlete. But what do you think about vitamin D? D?
Haha, got it. Yeah, I mean, this is one we would, or I would definitely support green light wise, provided we have blood testing, preferably the genomic testing, because as we talked about in that previous episode with Amanda, there's way more to vitamin D
Mhm.
synthesis, and that whole pathway is pretty complicated. So there can be a lot of genes involved, but this is one, right, where we have seen this higher deficiency. And when you put it into our athlete context and the many benefits of getting that D level in optimal ranges for athletic performance, injury, immunity, and so on, need I say more, Bob?
Yeah, I agree. I think it's a green light for me too. With the caveat, get your vitamin D blood work first to see what your levels are to dose the supplement
Yeah.
properly. So some people need a really high level amount, some people need a low level amount. So definitely do that. And I mentioned with vitamin K, I actually recommend vitamin K with D for certain athletes I work with.
Hmm.
If there's some bone issues, some osteopenia, osteoporosis, even some calcification if they in the artery
Yeah.
specifically. So if they have cardiovascular disease, if they've had a coronary artery scan and it's not showing that positive, so there's a time and place to include that vitamin K with it.
Yeah.
Okay, next one in the foundation, which we've been talking about actually quite a bit. We just did a series on this, omega-3 supplements. What
Ooh.
what say ye about those?
Yes, I would put the parentheses here, omega-3 parentheses, DHA, EPA
Yeah.
as the highlight, like stars of that category. And when we did that episode with Ilana Notker, she mentioned 90% deficiency
Mm,
worldwide of DHA, EPA. So this is very green light for me, Bob. Of course, we have to work with the person to see, what do we know? And like you said with D, this is something we can measure through an omega-3
mhm.
index test. So that's awesome to help guide the proper dosage and so on of the supplementation.
Yeah, definitely a green light for me too. I think, and as statistics kind of furthered my support of it, but I've got literally almost every person I work with is on some type of EPA DHA supplement at different doses, of course, for different reasons, but total green light, total green light.
Yeah.
Okay, next one is it's a two for one, but we're going to talk about magnesium, but specifically the two types of magnesium. The first one is glycinate, which is sometimes called bisglycinate, and then the other one called threonate. So let's
Yeah.
talk about magnesium glycinate or bisglycinate first. What do you
Okay.
think about that one?
Oh, you're giving it to me again.
Yeah,
Oh, yeah. I would say, given that a lot of us are also deficient in magnesium intake through food, I would be green lighting this one as well, bisglycinate, especially for our athletes competing, training at, relatively high volumes and load and so on. So, a lot of our endurance folk and our perimenopause, postmenopause athletes benefit to, I don't know if you really wanted me to give my reasoning, but
sure.
just as far as like role for muscle and brain support, relaxation, and so on. So, in brief, yeah, green light on the bisglycinate form for sure.
Yeah, I agree with that one. And
Yeah.
the threonate is actually because there are different types of magnesium,
Hmm.
and the threonate I actually have seen more efficacy in cognitive functioning personally
Yes.
and professionally. So there's a lot of research that is kind of suggesting take magnesium threonate for the cognitive standpoint and magnesium bisglycinate or glycinate more for the muscular relaxation standpoint. So I
Yeah.
think you can't go wrong with either or both, right? Especially
Yeah.
for because we're putting this in context with the aging athlete and cognitive functioning we know begins to decline at some point in our lives. So I think
Yeah.
that's a double green light for me. And then the next one is multivitamins, D. So I'm just going to take a little stab at this one really quick because I've never really been a huge supporter of multivitamins until I've started reading the research with how, as we age, how less efficient we become at absorbing certain micronutrients, so certain vitamins and minerals. And there actually is some research pointing to the efficacy of potentially using a multivitamin in a master's athlete or aging athlete population. So my feelings have been shifted a little bit changed more towards the aging athlete in terms of using a multivitamin. Now, context, there are like 3 billion multivitamins out there. Don't quote me on that, but I'm just trying to make some to get some drama there. But listen, when it comes to choosing a multivitamin, that's probably the hardest supplement to choose because there are so many and so many different doses. I think I've stayed away from multivitamins traditionally because
Yeah.
just because of that. They're very difficult to choose for the right reason at the right time.
Yeah. Yeah. I agree, Bob. I've come and gone with multivitamins. Sometimes I come back to them, but for the most part, I don't recommend them. But then there are the cases where, yeah, like a 70 and older person who also has had, appetite is in the tank
Hmm.
and they're just not eating enough for, maybe it's bouts of time and we're really working on it. And so it might kind of be one of those drop-in supplements for a period of time, but it's not one that I would say everyone should be doing. And I used to, when I was a brand new dietitian, that phrase like, well, it's extra insurance,
Yes,
that you're
yes.
meeting all your needs. And then after we've
Yeah.
looked and see for a lot of us, more is not better. And so I would say this is a conditional, like yellow light. Is that a option here? A yellow
Yeah, I think
light
yellow. Yeah.
ranking?
I'm the same with yellow. I think there's a lot of
Okay.
context it needs to be put into. Yeah. Okay.
Okay.
Next one, probiotics. Okay. Do you want to start with this one or do you
Uh,
want me to start with this one?
well, you can start with it, Bob.
Okay,
Like,
obviously we
yeah.
know we're gonna both agree on this one. We need to consume many prebiotics through foods, through fiber-rich foods, in order for our probiotics in our gut to actually do their job. So if we're just talking about a probiotic supplement, I waver on this one, D. We don't, unless you have had a stool sample, you don't really know what bacteria is living in your gut. And thus, if you take a probiotic supplement, which all of them have different types of bacteria, different strains, different quantities, you actually don't know what if the probiotics you're taking in a supplemental form are actually feeding your gut positively or negatively, right? Now, if an athlete is going to take a probiotic, what I do recommend usually is rotating. So every month you take a different brand that has different strains of bacteria to just kind of cover the bases. But for me, I don't know. It might be conditional, kind of like you're over 70 if you're not eating a lot of fruits and veggies, and maybe because you're guaranteed not to eat a lot of probiotics either for that reason, right? I mean, who's
Yeah.
eating a lot of miso and sauerkraut and stuff like that, right?
Right.
So I don't know. I think it's yellow light for me, but you have to put it into context.
Yeah, I'm a yellow light on this one too, Bob. I mean, I sometimes see worse outcomes when we supplement with probiotic, or it's like a temporary, as the
Hmm.
gut microbiome is adjusting. Symptoms can be worse, more bloating, more, some nausea and things like this. So my preference is to use the food first. And if there is signs, symptoms of GI issues or some other systemic problems, maybe doing a GI map test is something I would vote for so we can get a picture. I mean, it's not 100%, but it is more diagnostic in nature to then guide the food route and the supplementation route for probiotic choice.
Yeah, here's a really interesting side story on this, D. This is just last night. I was having a discussion with my daughter who is studying physiology in college, and she's working her way through that and going to go to grad school to be a sport dietitian. Nice,
Hmm.
right? Don't know if I have ever
Yeah.
told our listeners this, but anyway, she asked me a question last night. She texted me. She's like, "Hey, have you heard of this yogurt yet?" And I'm like, "Oh, cool." like, right? And
Ooh,
I'm going to say the name. I'm just going to bring it out because it's the first time I've ever
yeah.
heard of it. It's called Coconut Cult, C-U-L-T, right?
Okay.
And we'll put this link in the show notes in case anyone wants to look at it. But I was like, oh no, I've never heard of this before. And I'm like, where did you find that? Like, she's like, oh, it's all over TikTok. People are like screaming about it right now. And I'm like, oh, it's interesting. So she's like, hey, can you just give it a once over? Let me know what you think. And I was looking at it, I'm like, wow, this is really interesting, actually. I mean, in my mind, it's got some decent ingredients. From a gut health perspective, since we're talking about probiotics, I forgot off the top of my head. I believe, and again, don't quote me on this, everybody, but I believe it has like added 16 different strains of probiotics.
Hmm.
So, talking about like a probiotic supplement in a yogurt, right? So, because we know normal yogurt has probiotics, but this one is actually adding a lot of probiotics. The reason why I'm going down this road is because under the recommendation in terms of serving size, they only recommend that you consume 2 tablespoons at a time because there are so many probiotics. They don't want a negative, consequence to that. So that kind of
Yeah.
goes to your point. Like you want to kind of be careful about some of these probiotics. So I can just see someone like with this yogurt just going crazy, right? And grabbing a jar and they're just like, oh, I'm going to town on this. And maybe it's not a good thing. Like maybe you have
Yeah.
GI distress from too many probiotics, right? So
Oh,
it's
yeah.
just something to watch.
I'm looking at this product, especially a name like one of the flavors is chocolate mousse, but you're
Yeah.
right, the serving size is 2 ounces.
Yeah.
And
Yeah.
yeah,
Yeah.
ooh, more is not better in
Right.
terms of yeah, that potential threshold that
Yeah.
we're looking for. But this is a cool newer product out there.
Yeah. Well, and it's dairy free. And again, we're going to get off on tangent here, but anyway,
Yeah.
let's come back. So
Okay.
probiotics, I think for both of us, probably yellow light and put it
Yes.
into context, right? Okay.
Mm-hmm. Yep.
So next one is super popular for many reasons, but zinc, just our
Mm-hmm.
basic mineral zinc. What do you think of
Yeah.
zinc?
I think zinc, oops, Zeke or zinc.
Zeke?
I would
Zeke?
say zinc is going to be in that greener light category
Yeah.
for me, Bob. Again, a lot of dietary patterns are low in zinc intake. Of
Hmm.
course, always that we say broken record, we're going to try and boost your zinc intake through food. But for, let's say, our vegetarian, vegan athletes or people, their zinc content can be low. Someone who might have some other bowel disorders might need, some benefit there from zinc supplementation. And there's a whole host of other situations where zinc can be beneficial from a supplementation perspective. So yeah, I'm going to give this more green or light than the yellow red.
Yeah, I agree with you. I love zinc to death. I think there are a lot of deficiencies out there for sure. I think, the benefits are definitely research, right, in terms of what zinc does in the body. There are some deficiencies, like I mentioned. I would just say be careful in not overdosing this.
Yeah.
Unfortunately, a lot of athletes, kind of the mind is if I take one is great, but two is better, right? Or whatever it
Hmm.
is, right? So just
Yeah.
don't go too much because taking too much can actually cause GI concerns, right? So
Yeah.
you want to stay at kind of lower levels with zinc. Usually I recommend under 30 milligrams a day if you're going to supplement with it, depending on your dietary habits. But yeah, I'm totally green light for zinc also.
Okay.
B vitamins. So I guess let's just lump
Oh,
them. Let's lump them into like a B complex where you're getting,
okay.
again, the complex of all B vitamins.
Hmm.
What's your thought on those?
I would be more in the yellowish category. I used to be more green light, but this is
Mm,
something I've changed my mind on. Looking at, again, more embedded in the genetic pathways, nutritionally oriented. So aside from low intake of B vitamin foods, there can be some serious gene variants that affect
hmm.
why our processes in the body are not working very well related to more upstream or other pathways that kind of coincide. Ooh, that was kind of vague, but all that to say, Bob, I'm a little more on the yellow zone here for B vitamins. Again, like more isn't better. I don't know why I have to keep saying that. I'll try and not do that anymore, but
That's a good reminder for people.
however, a couple of the B vitamins, like for our vegan people, right, like B12.
Yeah.
you're not getting significant B12 in your nutrition. So we have to do something there supplementation wise. And
Yeah.
again, there can be other medical reasons to supplement with B vitamins. So we have to consider that. But for the, person who's not ill or doesn't have surgery or other stomach issues or intestinal disorders or some other conditions, I'd say for the most part, I would not lean towards supplementing with a B complex, but there are cases where I have done this.
Yeah, I think B complex vitamins have kind of been known as the multivitamin too. Like, oh, let's just
Yeah.
lump it in. It's a good insurance policy, whatever. If we don't use it, we'll pee it out.
Yeah.
Yeah, but I think I'm right with you. Like, especially when it comes to genetics, genomics, and looking at methylation pathways and the impact of B12 and folate specifically. And I kind of shy away from B complex vitamins supplementation before we actually have genetic testing. Once we have that, then I think we can understand it a little bit more, because then we can get further blood work analysis and look at some of these B vitamins. So yeah, I'm kind of with you. I'm kind of the yellow red until like we get further testing.
Yeah. Okay.
Yeah. Okay. Next one is pretty popular. I think we're both gonna probably
Ooh.
have something to say about this. Creatine monohydrates.
Yeah. Do you want to take it first, Bob?
Well, I mean, I don't think I even need to say anything. It's a green light. I mean, I can't
Total
even think of
green.
why it would be even a shade of yellow for me. It's like full on green for the aging athlete, makes total sense. You guys all know it. Listeners, you've heard us talk about it. You've heard it everywhere. It just makes sense. I think the only thing of question is what dose do you take? That's the
Yeah.
only thing that
Yeah.
that I question. Yeah.
Absolute green light from over here too, Bob.
Yeah, and I have
Yeah.
another one that we're not going to mention yet, and not going to mention as the foundation. It's more of a next level one. But anyway, so next one, pretty easy. This one is EGCG. I am not going to pronounce that. I'm not going to try
Oh,
to pronounce that, but that is the compound that is found like in green tea, right? The epilogue blah 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 blah. So let's
yes.
just call it EGCG.
Yeah, I would say I'm not a fan of supplementing this right at the moment. So yeah, I'm
Okay.
gonna red light this.
Okay. So
I
I have a similar but different perspective. I am all over EGCG if you are drinking it through green tea or matcha, all over
yeah,
that. Like,
yeah,
but in
yeah,
terms of like a pill, I get it. It's an antioxidant. It's very powerful. I totally get that for longevity in the master's athlete, but I just feel like you can get it in other places that makes it much more worthwhile. So I'm going to just call mine a yellow with this one. I'm kind of on the
yeah,
fence. I get the use of it, but I don't think you need to really supplement in a capsule form because I think you can get some great other food sources.
yeah. I mean, I should clarify. Yeah, I'm a big fan of the green tea, matcha,
Yeah.
and all that. But as far as this compound, doing it through your beverage or
Yeah.
foods,
Yeah.
yeah, would be
Yeah.
my preference. So yeah, more
Okay.
yellow, red. Yeah.
So the last one we're going to talk about today, and I feel like, this has been quite a list of foundation, and we still have a host of others to
Mm,
talk about on next level.
yeah.
Why don't we stop it at the foundation for this episode so
Yeah.
listeners aren't completely bored with us? And listeners, we'll do a follow-up episode where we talk about the next level ones. If everyone is in agreement, listeners,
That's
yes?
that sounds
Okay.
great. I'll answer
Dina?
for the listeners.
Okay. And so let's finish with the last one that's pretty popular these days, and as a foundation supplement, especially for aging athletes, masters athletes, and that is collagen. So
Mm,
what do we think? What does Dina think about collagen?
collagen peptides. I
Yes.
I'm gonna say what is the color when you mix green and yellow together? What color is that? Yellowish green.
It's kind of
I
like a vomit color almost.
oh no.
Yeah, like a Dr. Seuss vomit color.
I
Anyway.
know. I mean, I would say it depends on what outcome you're looking for,
Mm,
right? But
yeah.
if you have the budget, I mean, collagen is not vegan, so that vegan people cannot do
Mm,
vegan
right,
collagen. But I would
right.
say for the most part, I don't see harm in doing collagen supplementation. It's just if you're expecting, miraculous skin with no wrinkles, like, okay, that's not happening. If you're expecting all of your joint pain to disappear, that's not happening with this supplement, but it may help you in skin, hair, nails, joint health, cartilage, depending on kind. So my answer, Bob, is greenish yellow,
Okay.
yellowish
Yeah.
green.
Yeah. I kind of feel the same. I feel, there's so many different types of collagen, and popular ones are top five. Like it's one, two, three, four, five. Those are the ones you see mostly in supplements. But I feel like it's very collagen is very confusing, right? Because you have to
Yeah.
think, well, like to your point, like why am I using it? Is it for my hair, skin, and nails? Because that preemanates certain types of collagen that you should use, or is it for my ligaments and tendons? That is a different type of collagen. So, like when I'm working with athletes and injuries, like it's a different type of collagen versus just that, oh, hey, my skin is wrinkling and my nails aren't growing as fast. I'm losing my hair, whatever. That's a different type of collagen. So I'm with you. I mean, no harm, no foul, as long as again the quality is there. But if you're going to spend some money and you have some money to spend on collagen, sure. I would just say make sure you're using the right type for the purpose that you are wanting it to have in your body. So
Yeah.
for me, I would definitely agree with you. Mine's kind of yellow to green also.
Okay.
Yeah.
Whatever
Nothing
that
wrong
color
with it.
is.
It's just you have to, it's just such a
Yeah.
nuance trying to find the right type for the purpose you need.
Exactly.
Yeah.
Yeah. Wow, Bob, that was 10 foundational supplements we went over,
Was it
or
really?
11 if you include
Wow.
K, vitamin K. But yeah, that was quite a
Yeah.
few.
That was a bonus right there. All
Ooh.
right. Well, listeners, hopefully, especially if you're a master's athlete, hopefully you gained a lot from this one. And like I said, we will have a part two to this where we will cover more of our next level supplements for master's level athletes to kind of follow up to this. And these are ones that are not as popular. So you definitely want to tune in for that. And Dina, where can our listeners go to find out more and engage with us more?
Oh, yeah. You'll want to open up your browser right now and go to patreon.com/ISN podcast. And you can join us for free over there or pitch in a few bucks per month to help our podcast remain sponsorship free. So you're not having to skip through 21 minutes of ads. And we've got fun community that we're building over there with some behind the scenes content, Bob. It's been really fun to meet more of our listeners over there.
Yeah, it's super cool just to kind of be able to interact more on a personal level instead of just, broadcasting this and recording it, putting it out on the airwaves. So we definitely appreciate everyone's support here. Definitely appreciate your continued listenership, if that is a word. And listen, by the way, also, we would love your feedback, and even more so, we'd love some questions. If you have some questions that you would like us to either address, maybe even in our Patreon account. But if you have some topics you would like for us to explore in the future, all you have to do is send us an email, hello@insidesportsnutrition.com, and let us know what those topics are. We'll try to definitely, either acquire some guests to talk about those, or maybe Dina and I have the knowledge on those topics. So with all that said, everyone have a fantastic day. We'll catch you on the next episode.